friends, it's Mallory. Welcome to today's video. Today I'm going to be talking about what supplements that I take during pregnancy. So if you're new here, you may not know that I have had a pregnancy journey going here on YouTube. I have been filming a pregnancy update every single, well, not every single week, but almost every week since around week 5 of my pregnancy. And as I'm filming this, I'm 25 weeks pregnant, but it won't be going up for another week and a half. So I will be very near my 3rd trimester when this goes live. But I wanted to share with you guys what supplements that I am taking in pregnancy. Now, I do have to put out a disclaimer that even though I am a registered nurse, I cannot give medical advice as a nurse, neither can I give really nursing advice specifically to individuals, because I'm not I'm not taking care of you specifically. And all I can do is, as an individual, share what I'm doing to keep myself healthy in pregnancy. So do not take this as medical advice. Do not take this as a prescription on what you should do in your pregnancy. It's very, very important that you talk to your healthcare provider on what is good and safe for you. But I just wanted to share what I'm taking in pregnancy so that other women can get ideas on what might be good for them and what you could present to your doctor and do your own reading about. Also, I am taking 2 medications in pregnancy. But because YouTube is funny about talking about medication names, I am not going to talk about those things here on YouTube. However, the day that this video goes live on YouTube, over on my Instagram channel, which is Warrior Life Wellness, go take a follow there, you will find information in my Instagram stories about what medications that I'm taking during pregnancy. Once that 24 hours is up, then you can find those stories in my highlights. So just go to my Instagram profile and you'll see the little highlights, the little circles, and click on the one that's about medications in pregnancy. So you can still learn what meds I'm taking, but I will not be talking about it or putting it in the description below here on YouTube. Okay, so with all those technicalities out of the way, let's jump into the content. All right, so it probably goes without saying that if you are pregnant, you're probably aware that taking a prenatal is something that is preached and preached and preached. No matter who you talk to, who you read, everyone says to take a prenatal during pregnancy. This is very, very important because it just gives you a baseline to kind of cover, to give yourself some insurance where your diet may be lacking. So for me, I take the brand BioCare, and this is made in the United Kingdom. This is the methyl pregnancy multi-nutrient. And the reason I take this specific one from BioCare, they have another prenatal, but the reason I take this methylated one is because I have what is called a homozygous C677T MTHFR polymorphism. Some people call them mutations, genetic mutations. Basically what that means is that my body, because of the MTHFR polymorphism, my body is not able to process synthetic folic acid into folate. So that's what the body has to do if you're taking folic acid, and most prenatals have folic acid in them, but it's the synthetic form of folate, which is the naturally occurring B9 vitamin that occurs, that's in leafy greens, lentils, things like that. My body is just not able to process folic acid as efficiently as somebody who does not have the MTHFR polymorphism. So I take a prenatal that has methylated folate in it. So that basically means that the folate in this prenatal is already processed so that my body does not have to go through the process of converting it into the form that is active. So it's an active form of folate in here. You can find out if you have the MTHFR polymorphism from things like 23andMe. You can also get a genetic test through your doctor sometimes. And even if you don't have the MTHFR polymorphism, it's still, in my opinion, better to take real folate rather than the synthetic form of folic acid. And also the reason why this is so important and I'm harping on it is because folate is necessary to help prevent neural tube defects in your babies. A neural tube defect is where the spinal column does not close. So your baby could have spina bifida or, you know, some kind of spinal abnormality with a neural tube, like if they don't get enough folate. So it's super, super important to have folate, especially during that first month of pregnancy, which many women don't even know that they're pregnant during that first month. So it's really important to actually be taking a prenatal before you get pregnant. Okay, another thing that I was taking in early pregnancy because of this whole neural tube defect thing is I was taking extra methylfolate. So this is the kind that I was taking. Again, it was from BioCare and it's a liquid form. So you just open it up and you put drops under your tongue. 4 drops is equal to 400 micrograms of folate. And in pregnancy, you want at least 400 micrograms. 800 is ideal. So I would do 2 to 4 drops per day, but I only did that during the first trimester and I haven't been doing it anymore because by now, like the neural tube is like long closed, like everything. If there was any defect, taking extra methylfolate now wouldn't do anything. Okay, another thing that's really, really important to me, and for me, my minimum of what I need to take is a prenatal and omega-3 fatty acids. So omega-3s are very important for brain development of the baby, and they're also important for mom's brain. You know, you get that pregnancy brain and, you know, you get kind of forgetful. So I'm not saying that omega-3s will cure that, but it will help your brain to function a little better. Over the course of my pregnancy, I have taken a few different brands. So for the majority of the time, I have been taking a brand called Ava Labs, and I don't know if this is available in the US, but I order it from Amazon.de, so the German version of Amazon. Very reasonably priced, and it's a higher dosage of omega-3s. So the per dose, like per day, you're getting 800 milligrams of EPA and 400 milligrams of DHA per day. Also, I was trying to supplement with 1 capsule of the Nordic Naturals prenatal DHA because DHA is the kind of omega-3 that is especially important for your unborn baby's brain development. So I wanted to get a little extra DHA because the Ava Labs one was a little heavy on the EPA. I mean, it's not a bad thing, but I just wanted more DHA. Right now, I am taking this omega-3 1,000 milligram capsules. This is from a pharmacy. This is a prescription one. It's from a pharmacy in the UK. And this one you get 460 milligrams of EPA and 380 milligrams of DHA. So it was really cheap. It was like £4, I think, but it's not as much DHA and even EPA as I want to get. So I think this will be the last time that I take this, and I'll just order the Ava Labs again. Okay, the next supplement is Hydroxo B12. So you may be thinking, what? So basically, it's a more absorbable form of B12, and B vitamins can be very helpful in boosting energy. And we know that in pregnancy, fatigue is real. Now, B vitamins won't take away that fatigue, but it can be helpful for cellular energy. So this is the type that I've been taking. I take half of a lozenge in the morning, and that gives me 1,000 micrograms of extra B12. And B12 also works in harmony with methylfolate. Okay, another B vitamin that I have been taking this whole pregnancy is B6. And you may have heard of this for as a morning sickness remedy, a natural morning sickness remedy. This is just the brand. This is from the PX, just a generic brand. And each tablet is 100 milligrams. It has a little like line in it, and I have a pill cutter. And so earlier in my pregnancy, I was doing 25 milligrams 3 to 4 times a day. Okay, and that should be the maximum dose. Like, you shouldn't take more than 1 full capsule a day, 100 milligrams. And now in the second trimester, I'm taking like an average of 50 milligrams a day. I'm not really dealing with morning sickness anymore. But when I was, this 25 milligrams 3 to 4 times a day, just spread out over the day, was so good. Okay, the next supplement is magnesium. This is another very critical nutrient. It's a mineral, and we hear a lot about calcium, but we don't really hear much about its sister, magnesium. And so this is the magnesium I'm taking. This is the Doctor's Best high absorption magnesium. And you get 200 milligrams a day. The source, the type of magnesium is magnesium lisonate glycinate chelate. It's kind of a mouthful. There's a lot of different types of magnesium. Some are better absorbed than others. Like, you may know magnesium citrate is good for if you're constipated, but if you want something to absorb really well, I have read that glycinate is one of the more absorbable forms, and this is chelated, which helps it be more absorbable. Why is magnesium important? This is important for both your muscles and your bones, and also for that of your baby. Magnesium helps, along with vitamin D, magnesium helps calcium to go to where it's supposed to go into the bones instead of depositing in other places of the body. Now, I mentioned vitamin D. I was taking extra vitamin D at the very beginning of my pregnancy and pre-pregnancy, but at my first prenatal appointment, I got tested for my vitamin D levels, and it showed that I was kind of on the higher side, like not dangerously high, but high enough that I could stop my extra supplementation. The prenatal that I'm taking does have vitamin D in it. Let's see, it has 1,000 IUs of vitamin D. So vitamin D is very important. You don't want to be low in vitamin D. It can cause even like symptoms of depression. It can really mess with your mood and your energy. So you want to make sure you're having enough, but I didn't need to take as much as I was taking. The next supplement, which many people may not even be aware of this supplement, so I'm really excited to show you guys, is sunflower lecithin. Sunflower lecithin. And I take this for the phosphatidyl choline, okay? Phosphatidyl choline, you just call it choline. And I'll try to find a link that talks about this, but I learned this from Lily Nichols. She is a registered dietitian and certified diabetes educator. Choline is just as important for preventing neural tube defects as folate. And most people don't know that. Choline is really a type of B vitamin, but it's really not talked about very much except in like functional medicine circles. I am a total huge fan of choline, taking sunflower lecithin. It's also important for a baby's nervous system and brain development. So I take 2 soft gels a day, and that gives me 2,400 milligrams of the sunflower lecithin. And that's a total of 420 milligrams of actual choline. So other like food sources of choline would be egg yolks, liver, things like that. Really from animal sources is the best place to get it. And I don't eat eggs very often because I'm intolerant to egg whites. So if you're intolerant to eggs, then it's I feel very compelled to take choline. Okay, another extra vitamin that I take is vitamin E. And I started taking vitamin E as an extra supplement under direction of my functional medicine doctor several years ago. And this is just the type that I'm able to get here. It's mixed tocopherols and tocotrienols, so it's like different types of vitamin E. I take 1 capsule every other day, so that's 225 IUs per capsule. And vitamin E is a potent antioxidant, so it helps fight free radicals and things that could be cancer causing. And then I also take vitamin C as another extra vitamin. And vitamin C is also an antioxidant. And I take 1 tablet every day. And so that's 1,000 milligrams of vitamin C. In addition to being an antioxidant, vitamin C, we probably all know it as like the immune system vitamin, but it's better to take it like before you get sick. And it's also important in the production of collagen, which collagen is important because your belly is stretching, you know, you might be getting stretch marks. And while stretch marks are mostly genetic, a lot of people feel good about trying to increase their collagen production. So taking vitamin C can help with that, so that you're, you know, it's beneficial for your skin. And also it's beneficial for baby because they need collagen for development. And then finally, vitamin C can help the body detox and to help absorb iron better. All right, another thing that I take, but I don't take it every single day, is cranberry pills. And this is just the brand that I'm taking right now. I just kind of buy whatever I can find over here. But like I said, I don't take them every single day, but I try to take like 1 a day, 1 to 2, because I am prone to having UTIs, urinary tract infections, and in pregnancy, you're even more prone to them. So I just kind of try to maintenance that and try to keep a UTI at bay. I also have recently started taking Beano. That is a digestive enzyme, and I take 1 tablet with meals that I suspect will be more gassy, and it does help me to digest my food a little better. I also take lactase enzyme because I'm a little bit lactose intolerant, so I take 1 tablet of lactase with dairy, such as ice cream or cheese. I don't need it for yogurt because it's fermented, but for other dairy products, I take that. And then in the evenings, I take a probiotic, and I switch between different brands. It's good to not let your body get used to one particular strain or group of strains. So right now I'm just taking this one right now. You can get this at the PX and it's pretty affordable. It was like less than $12 for a month's supply. And I really like that one, but it is good to switch it up. I was taking a different brand this past month, so I switched this month. So you don't have to switch every single month, but I think I like this one better than the other one I was taking. Also, last couple things, sometimes I take magnesium powder. So one of the forms that powder might come in is magnesium citrate. And sometimes I take that upon direction from my doctor because he said it's good for cramps. So like in pregnancy, you have a lot of stretching going on. There's our dog. You have a lot of stretching going on, ligament pain, and he said that taking magnesium can help with cramping, and it also can help with constipation, which is another pregnancy issue. And then finally, one more magnesium product. At night, I use magnesium gel. So this is a topical treatment. This is a topical mineral, topical magnesium, and this comes from the Zechstein C, the ancient Zechstein C, and it's in a gel form. And I really like the gel. You can get it also in a spray or in a lotion. And I apply this to my calves. I just do, I don't know, a little bigger than a pea size amount on each calf right before bed, because it does help with sleep, like with more restful sleep, and just kind of makes you a little more relaxed. A lot of Americans are deficient in magnesium because of our depleted soils, like from pesticide use and things like that, and just overusing the soil. We've depleted the soil of vital nutrients. And so I try to get in as much magnesium as I can. All right, so those are all the supplements that I take. Here's my box of supplements, and that's not even all of them. I know it seems like a ton of supplements, but I was actually used to taking a ton of supplements. I've taken more than this in the past. I was under the care of a functional medicine doctor for several years to work on some chronic health issues, and he had me on a bunch of stuff. So I'm used to taking a lot of pills a day. Sometimes it is hard to choke down larger pills when you're pregnant. There's a lot of options out there. One of my recommendations is to look for supplements that are high quality from reputable brands, and to just spend your money on things that are going to be worth it and that you literally won't be just flushing down the toilet because your body is peeing them out because they can't be absorbed because they're synthetic or just not good quality. So definitely do your research on what brands are the best. When I go back to the US, I probably will switch up many of the brands that I'm taking. So I might do a follow-up video to this of what I'm taking. Maybe I'll make it like, what am I taking postpartum or something like that. But this is what I'm taking right now, and I feel great. I actually feel sometimes like my prenatal gives me more energy, and it has never made me feel sick. So I'm a huge fan of BioCare. Make sure that if you're watching this the day this goes live, to check out my Instagram stories so you can see the 2 medications that I'm taking in pregnancy and why I'm taking them. And then if it's not the day that this goes live, it's like past the day, then make sure to check out my Instagram highlights for those stories. I will save them so that you guys can see them. And if you have any questions about supplements, remember, again, I can't give medical advice, but I could maybe refer you to some good resources. Leave your questions in the comments below. I'd love to hear them. And until next time, take care, everybody. Bye.